what is the choice in post-cataract surgery dry eyes? I'll ask Dr. Anagha first to take that.
Yeah, that's a very good question. In fact, I would say why post cataract surgery? Before the cataract surgery, ideally you should look at the tear film of the patient, which we are doing for all our cataract patients. If you feel that the patient's myography shows dropout, or if you feel that he is an MGD, then definitely you will need to treat from that point of view. So you can use sodium hyaluronate. So it depends on the severity of the dry eye of the patient, depends on what kind of deficiency. If your patient has a rheumatoid arthritis, if he has a severe aqueous deficiency, then you need to use lubricants, you need to use high viscosity, you need to use preservative free formulation. Especially post cataract surgery, the main problem is because they have already been putting dilating drops, they have been using and multiple treatments like steroids and NSAIDs and antibiotics. And plus, if they are diabetic, old age, already there is a compromised tear film, so they are more at risk of dry eye. So here you need to have a high viscosity, high retention time. So ideally, you can use a combination of CMC and hyaluronic acid. If you feel that the patient is a diabetic or there's a small epithelial defect, you need to promote cell migration. So definitely HA and CMC works better. So it all depends on that. Preservative free would be the best thing.
Dr. Himanshu sir, your take on this, because I have heard from you on a lot of occasions that it is actually the post-cataract dry eye patients who we need to look at more carefully than your regular patient that comes in, because that patient will be really after you for life.
Most dry eye, I'm asking the whole panel and everybody who's watching this, which is the biggest complaint and the irritant to you post-operatively? आँख खटकता है,
गड़न चुभन,
चुभता है, खटकता है, पानी आता है.
Don't give a plan for the vision.
You've done a great job in a brown cataract. She's got 6/6 and 5 vision. Everything is beautiful, but your surgery is waste. It's a failure. नहीं, मेरे को lens खटकता है. And we keep talking about LASIK dryness. And believe me, here there are LASIK surgeons. Chitra, do you think LASIK, post-LASIK? I mean, there is dryness, but it's not that bad after a little time. But cataract ones are the ones who crib big time, despite them seeing well. And we are blaming LASIK most often. So this is what I'm saying. We are blaming with a small 2.2 millimeter incision, if it can create so much of trouble. And you tell them, you पहले था ही नहीं हमको dryness. Operation के बाद ही dryness. And believe you me, my patients go elsewhere and other people's patients come to me. कि operation खराब कर दिया, मेरे को आँख खटकता है. This is a commonest problem that I have seen post. Vandana, what do you say? You agree with me?
Absolutely, sir. Absolutely.
All my patients go to her post-operatively. They never come back.
Your patients are supremely happy with you, sir. They go nowhere.
No, what I'm kidding is that this is the problem and you have to tell them that lens नहीं खटकता. किसी और का आया तो भी पहला मैं बोलता हूँ ऑपरेशन बहुत अच्छा है. Just now, about 2 hours back, I had a patient. Big time trouble. मेरा दोस्त है लेकिन वो कुछ गलत लेंस डाल दिया. मेरे को खटक रहा है बहुत. Now they don't realize, and this is the biggest problem with dry eyes. Now with respect to what Anagha says, no question that preservative free is the best option. But cost is the one which is going to kill you. Ideally your one use, FDC had to stop manufacturing. That was my favorite. The sachet which was there, you give them a sachet and you put that, and people don't like to waste those 2 drops also. They crib. So yes, that is the idea, but we are not working in the ideal scenario. Now Anagha said very nice that try this and then try this, and believe me, by that time patient has lost. You have lost the patient. So what happens is they keep going, and it's a long-term learning process. This is even Varun said 30, 40, 50 patients in the beginning. If you have only few patients, no sir, even there 60% of your client is going to be suffering from this. And they are the ones who are going to get you 400 after 5 years. So if they have this khatakna business and all that, they are the ones who are going to crib more, despite you giving the best of the thing. And of course, we all agree that little blurring, that when you're watching TV with excessive television time, they all have a lot of dryness because they stop blinking and their tear film breakup time becomes worse post-surgery. So
this is something which I started doing, sir. Along with the drops, I think the first day post-op, I counsel them about the fact that they need to only pay attention at the vision. We start preservative drops, which obviously have to fit economically as well. I can't give them post-op medicines which are 500, 600 and 400 ka lubricant. So I have to keep that in mind. And I, as a policy, make them have lubricants for at least 3 months after the surgery.
Correct, but
they are told that this will happen because you're taking 5 or 6 chemicals. The fact that you shouldn't, pay attention to that. You should look at how clearly you're seeing, etc., and so on.
So that's where I envy a cardiac surgeon. For 1 month, that guy is with 1 tube here, 1 tube here, 1 tube there. So all the pain is so much that he stops scribbling about the heart only. He's scribbling about everything else. Exactly. Whereas we, by evening, if they can't see their WhatsApp, you are a bad surgeon. If they start khatakaving after 3 days, you are a bad surgeon. So unfortunately, that being so, dry eyes is a huge problem that we are seeing in front of us. And Rohan, as you asked, so that's why I started the whole thing. Everybody agrees unanimously that the huge post-op problem is this. Routine dry eye patients are to there only. A contact lens, you tell them you're dry eyes, nahi, itna nahi problem hai, bahut kam hai. They want to keep wearing contact lens despite their problems. They will justify, till murder they'll justify. No, I'm very happy. Look at Nimrata, really smiling, she's giving the best support.
I have, seen all of this, and I have a patient also. She's 6/6 now. I think females have more dry eye. Husband is like, तुमने मेरा किया था तो ठीक था, इसका क्या कर दिया? She's 6/6 unaided, and she's got a monofocal, and she was like one of the low bracket, patients. But she's like, इधर कुछ चुभ रहा है, इधर कुछ चुभ रहा है. And you have to, sometimes we end up giving them cyclosporins and so much supportive treatment till the end that it drives you crazy. I've even tried those holopetidine ketorolac combinations. Pani aana band ho jaye, no matter what you put in.
Bhagwan bachaye, kuch bhi dalo. So, Pooja and Rohit always mentions that psychiatric treatment also should be a part of the armamentarium, actually.
Absolutely. The counseling has to be done. You are a psychiatrist plus a dry eye specialist that time.
No, and they will break your head. They'll be sitting there and cribbing in front of everybody. बहुत खटकता है, बहुत दुखता है.
And they have a point. They have a particular point on the lid where there is always a pain.
That is the lens. Bad surgeon.
Yes, so I agree with all the points they were said. But this is, I think, in cataract, we see what Dr. Himanshu Mehta said. This is very, very common, and we see this routinely. So I think most of us, rather all of us, use a tear preservative-free drop in our routine post-op care. This is what I've been doing now for a long time, and I think all of us in the panel do it. Am I right here? Everybody uses some tear preservative-free drop in their medicine routinely on a daily basis.
Rohan, I just had a point. We had done a study regarding this post-cataract dry eye, and we had compared doing conventional treatment. We had access to LipiFlow, so we had done that. This was pre-cataract surgery, and in patients who didn't have any kind of treatment, they had the worst objective parameters of the tear film. So even doing something like a hot fermentation or treating the MGD beforehand, about 3 weeks before surgery, makes a massive difference to your tear film parameters. And we actually got a very nice set of data to explain that. And specifically, we were looking at cataract surgery patients in this. So,
did the objective finding and the subjective findings match, Rushad, in that?
Yes.
Answer the questionnaire post-op?
Yeah, the questionnaire did match it. It wasn't matching the meibomian gland scoring, but it was definitely matching the TBUT and the lipid layer thickness that we had measured. So that was something that we found, and we are going to publish that in a few months' time. I think we're just writing it up.